Today we're going to talk about these small white oval shaped irregular spread over white lesions that you see over the body. Often it is misdiagnosed. Often patients take all the antifungals, the itraconazole, luliconazole, disease coming back again and again. Most of the time we see patients ignore it because it doesn't have any itching, no symptoms. While there are some patients that are very serious about this condition because of the bad appearance, they want a real cure. And we see patients across the globe today, patients need a cure for this, for such a condition that's reoccurring. Same kind of itraconazoles done for several years. Through Ayurveda, patients get a lifelong cure. So how do you really look at this disease, what it really is, what is the Ayurveda point of view, and how very easily and naturally we get rid of it? Let's understand in this video. Keep watching, we'll be back. Namaste everyone, welcome to Jyovis Hospital of Ayurveda and Aesthetic Center, Mumbai. This condition called as Siddhma Kushta in Ayurveda years ago. In today's time we know it by the name of Tinea Versicolor. Let's understand what this is. So it's caused because of this fungus Malassezia globosa. This Tinea Versicolor commonly seen over the chest, shoulder, if we ignore it, seen over the back, it spreads, those small irregular oval shaped lesions. It doesn't have any itching, so most patients just ignore it, but it shouldn't be done. We need to have some action, need to cure it, otherwise it may spread and it has a very bad appearance, so may it not look really very presentable. That's one part of it. In Ayurveda it's called as Siddhma Kushta, which is a Vat Kafach condition, whereas other kinds of tinea, corporis, cruris, capititis, berbere, ungium, these different words which are made to just pass the exam, which is just like every other tinea infection. This is Dadru as per Ayurveda, which is a Pitta Kafach condition. Although we see the involvement of Pitta, fire, heat in the Siddhma Kushta, but that condition is Tri-doshik, which is all the three doshas are involved in that kind of Siddhma Kushta. But mainly Siddhma Kushta is Vat Kafach, Vat, which is the air element, which is dryness. Once the air is aggravated, it further pulls the Pitta and pulls the Kapha. So very important is take care of the Vata, take care of the dryness. Just how air is outside, air is present within the body and it has to be in balanced state. As per Ayurveda, a big reason for Tinea Versicolor, what it really does is that Vata and Kapha, these two doshas are mainly aggravated. It manifests in the skin, there is accumulation of toxins, ignores patient, of course as always. We see deeper penetration and then the Rasa, Rakta, Mausa and the Lasika is affected. Rasa, plasma, Rakta, blood, Mausa, muscle and Lasika is the lymph. We see Rasa, Rakta, Mausa and then from Mausa is the Utpatti of the skin. So these three, Rasa, Rakta and Mausa, this has to be functioned, the functioning has to be normal, has to be proper. But when these doshas are not in a balanced state, it further aggravates and deeply penetrates into these tissues and we see the problem further proceeding, further spreading. Very important part to explain you in simple easy language is this fungus penetrates in the skin, irritates the skin and spreads further, and the entire fungus is spread and leads to the presentation, the irregular oval white scales, lesions, often misdiagnosed as vitiligo. But they are very different from vitiligo. After n number of itraconazoles, luliconazole, vitiligo tacrolimus ointment, so many different treatments, patients come to Ayurveda, and through Ayurveda very easily and permanently patients get lifelong results. Over here, important part is that Ayurveda has the Panchakarma like the Raktamokshan, Vaman or Virechan. There is the Nasya. The treatment starts from Kurumi Chikitsa, moves to reducing the dosh, Shodhan Karya, and then ends to the Rasayan Chikitsa, where we see no relapse ever at all once the tinea infection is cured, whether it's the fungal infection ringworm or whether it is such kinds of Tinea Versicolors. Over here, n number of herbs, n number of treatment modalities. Very easy home remedy part is one can simply take Gandhak, which is pure purified sulfur, mix it with the neem leaves, and then you can mix these two ingredients with petroleum jelly and hydrate the skin, apply it over the skin 2-3 times a day. One can apply Durva, which is what we offer to Lord Ganpati Bappa. So this Durva, we make a swaras, we consume 10 to 20 ml early morning empty stomach. At the same time, we keep the base as coconut oil and we prepare a Durvadi tail and apply it externally. This Durvadi tail is also available in the market. So Durvadi tel, Somaraj tel, Sinduradi lepam, we see Nal Paramadi, telam, all these very easily available oils, just hydrate it and we see the patches disappearing. So mainly Vat Cough has to be targeted. Internal combinations are of course very important. Medicines like Tuoxymed, Sorasi syrup, these are of course very useful to target that root cause. But overall, internal, external, both kinds of treatments are useful over here. One must not ignore it because of just the bad appearance, but it may further spread and may have other repercussions. So always best to cure it from the roots in a natural way. Once you're done with all itraconazole, luliconazole and every different brand that has these same ingredients, make sure you choose Ayurveda, make sure you choose wisely, and that's how Ayurveda cures the root cause. This was all for now. Any doubts you have, let us know in the comment section below. Share this video with those whom you find they have the tinea infections or any skin disorders. Until next time, I am Dr. Raj Satpute from Jyovis Hospital of Ayurveda. From the entire team of Jyovis, look impressive, be progressive.